Hi, good morning, and thank you for joining us on our Facebook Live. My name is Adam Thacker. I'm the Chief Operating Officer here at Good Samaritan. You will notice Dr. Stein is not with us today. He had other responsibilities on his physician role to take care of this morning, so I'm going to give you a few updates on the COVID-19 situation here at Good Samaritan and in Knox County. So we've had 853 individuals tested to date for COVID-19. We have 29 positive cases in the county. So if you go to the Indiana State Department of Health and look, you'll see the 28 cases. That'll be updated today. So we have 29 cases. Still remains a very low prevalence of COVID-19 in our community, which is great. That again goes to the kudos to everyone in maintaining safe practices with social distancing and hand hygiene and monitoring yourselves for any symptoms as we continue to reopen and return our community to a normal. One thing that we talked about last week was the looking at visitation around the hospital, and certainly same as we've been able to stay on the back on track plan and even move that forward at a quicker pace than was initially laid out. Because we've had a lot of success in controlling the number of cases here in the community, we're able to move forward with relaxing some of our visitor restrictions. So what you'll see sent out and communicated is that starting June 3rd, this Wednesday, we will be allowing one designated visitor per day to visit inpatients here at the hospital from 10 o'clock in the morning, 10 a.m. to 6 p.m. will be the visitation hours. So that's a great thing. As we've mentioned in the past, we certainly understand the healing aspect of having family and friends close by, and as you're getting medical direction, a lot of time patients are disoriented or just tired, and there's a lot of information flowing, so having that person there with you, a loved one, caregiver, to help in understanding medical direction as you transition from an inpatient setting to your home or the next level of care. Certainly having a visitor here with you will help in that regard. We will also be allowing one visitor in settings in the outpatient area, such as the emergency room, outpatient surgery, our outpatient medical offices. So there will be visitors allowed in that as well. There'll be more details coming out that you'll be able to review, and we ask that if you are going to visit somebody at Good Samaritan or are coming to an appointment with a loved one, that you do review those in advance and just understand the expectations as a visitor. So what has not changed? There are still screening stations. There are still universal masking expectations. So as a visitor or a patient, when you come, you will come in through the health pavilion entrance, and there will be a stop point for the screening station, just as there is today. You will be provided a mask. If you have a mask, a cloth mask or a procedure mask that you already wear in going to the grocery store or out in the community, please bring your own mask, and you are allowed to use that. But you will go through the screening station. As a visitor, if during the screening process it is identified that you have symptoms or other trigger points that would be of concern for coming into the building, you will have to wait outside, and we'll communicate that at that time and walk you through that. And as mentioned, the masking will be something that we'll need you to follow when in the hospital or going anywhere across the campus. Also exciting today, we reopen our Williams Brothers retail clinic. So it seems like a year ago, but it was just a couple of months ago we opened a new clinic inside Williams Brothers Pharmacy on Washington Avenue as part of a strategy to have a clinic inside of a pharmacy. Shortly thereafter, we closed that clinic as we moved to a process of addressing the new resurgence of COVID-19. Today, that clinic reopens. It's open from 10 a.m. to 8 p.m. Monday through Thursday, and we'll be accepting call-in appointments or appointments via online check-in. We have the MyChart app that will allow you to check in through the Find Care Now component of that app. And when coming, we'll ask that you follow what's called the park and call model. So when you pull up, there are designated parking spots. You'll call into the clinic, and then they will come out and meet you. That's just an effort to keep waiting room activity down during this time, as we're still being very diligent in watching what's going on in that regard and making sure that we're keeping everybody as safe as possible from being in close contact, maintaining that social distancing. That park and call model is the same that we're using at our convenient care location on Willow as well. So really exciting news that we continue to move forward. With the 29 cases, I would also mention that we have 24 of the 29 are through their quarantine process considered recovered. So we have 5 active cases in Knox County, which is a really low number. And all 5 of those individuals are recovering at home, do not have any that are in the hospital at this time. Currently also have 0 deaths in Knox County, which is a great outcome thus far through COVID-19. And we feel really confident as we continue to move forward that in working collaboratively with the local health department, with state resources, that we're staying on top of this from a community standpoint, and certainly appreciate all that the sacrifices that individuals in the community are doing to keep everyone safe. So with that, that's the updates for the day. The good news is there's not a lot of change. As some of our past presentations, there's been things changing dramatically and a lot to cover, but we continue to stay moving forward with the Back on Track plan. Community numbers continue to look good. That also means that we need to remain diligent. The little things, the hand hygiene, the monitoring your symptoms, and not going out in public if you don't feel well. If you're that at-risk population that's over the age of 65 or have medical conditions that may make it more difficult to recover from COVID-19, then still having a plan in place to stay at home as much as possible, or lean on family members and friends to help with some of the errands that may need to be ran, and just continuing to be safe through this process. So now if there are questions, I'll take some questions.
Okay. The only question I have right now is pertaining to behavioral health offices, specifically the Willows. Like, what about opening up those offices?
Those offices are reopening as well. So our Samaritan Center offices, both the Willows for child and adolescent visits as well as our adult mental health offices, are seeing patients. There's a combination of virtual visits that are an option, as well as in-person visits. And then, as you may know, with a lot of the behavioral health sites, there's a lot of group therapy, and they are working through processes of being able to perform those and maintaining the distancing and all of the safety precautions that really need to be in place. But contact those offices, so you can find them on our website for the numbers, or if you're an established patient, you probably already have that information, and they can guide you through whether a virtual visit may be the best option for you, or whether an in-person visit would be the best option, and then they can schedule that appointment at that time. All right. Well, thank you for all that tuned in, and continue doing what we're doing and staying safe and following all of the precautions that are part of our new normal at this time. And we'll tune back in next week and hopefully have a similar update that we're continuing to follow the Back on Track plan and in good progress with what we're doing here locally. So thank you.